Dr. Cynthia Wilson. Oh, getting the recording going, and Dr. Vittoria De Lucia.
All right. Thank you, guys. Thank you, everyone, for joining tonight. I think this is a super exciting topic. And it is the first that I know of, at least, of a joint venture between the Connecticut Council of Child and Adolescent Psychiatry and the Maryland Regional Council of Child and Adolescent Psychiatry, which I also think is super exciting. And we actually got some recognition for that at the last AAPI meeting in Toronto, which is really exciting and such an important topic. So just thank you to Dr. Yuen and Dr. Adiba for highlighting this topic and for everybody that joined.
Hi, everybody. I'm Dr. De Lucia. I'll wait for them to switch over for a second. Hi, I'm the president of the Maryland Regional Council of Child and Adolescent Psychiatry. I would like to thank my predecessor, Dr. Jonathan Shepard, who isn't here tonight, but who helped support this project, Dr. Afifa Adiba, who brought this project to us. On a personal level, I feel really strongly about this case. I myself am transnationally adopted, so it's important to recognize that even though we might look a certain way, it's important to realize that not all cultures are intuitively understood. Professionally, I am the chief of trauma at Shepherd Pratt, so understanding trauma and how it begins is very important to me. And as a person who loves children and who loves the arts, I think this is a great way to figure out how we can reach people without just medications and our usual maybe luxury style of delivering care. So I'm really pleased about this project and I'm really excited to get started. Thank you.
Amazing work that everyone is doing. I will introduce myself. I will be your host from Chat Together. My name is Amelia Lowry, she, they. I am a public health student focusing on mental health, disrupting cycles of trauma, and promoting collective community healing. I grew up in the Bay Area of California. I am biracial, Black and Chinese, queer, able-bodied, and a cisgender woman. Today's agenda will proceed with additional introductions, more details about the program, the skit, AAPI Intergenerational Trauma, the shark music, group and panel discussions, and resources, and a survey poll. Next. All right, so disclaimer, the goal of the discussion is not to offer professional medical advice or a political platform, but to serve as a healing space for discussion and to increase mental health awareness. Any immediate concerns regarding personal health, safety, and well-being should be appropriately directed towards your mental health provider or your primary care clinician. Please change your name on Zoom to anonymous if you would feel more comfortable remaining anonymous. If you have questions during the presentations, please submit them through the Q&A function. Q&A function just so that they don't get lost in the chat. And then you're welcome to share resources through the chat function. Thank you. So AAPI Trauma Healing Program Introduction, Dr. Eunice Yuen, Assistant Professor of Psychiatry, Yale School of Medicine, Child and Adolescent Psychiatrist at Yale New Haven Hospital, Associate Medical Director at the Parent and Family Development Program, Yale Child Study Center, founder and director of Chat Together, stands for Compassionate Home Action Together, a culturally and family-oriented program using interactive theater as educational tools to promote emotional wellness in Asian American children, young adults, and parents. Dr. Yuen grew up in Hong Kong and is a proud mother of 2 Asian American children. Dr. Afifa Adiba is an inpatient attending in child and adolescent psychiatry at the Shepherd Pratt Health System, service chief for the Adolescent Co-ed Mood Disorder Unit, affiliated with the University of Maryland and Yale Child Study Center. Throughout her career, she has been involved with advocacy and research. Her work with local organizations and media aim to reduce mental health stigma with a focus on increasing accessibility of care among minorities, AAPI mental health, and healthcare. So now I will pass it over to Dr. Yuen, who will provide more additional details about the program.
All right, so thank you so much for all the introduction. Myself and our whole team are so excited for tonight and welcome everyone to join us. I understand that's at the end of the day. I hope like tonight it will be an interesting and interactive webinar together. And so if we can get back on the slide, I'm trying to introduce the AAPI Trauma Healing Program and the calling behind this. All right, thank you. So, so before we get into the exciting part, learning about theater and how that impact mental health, I want to discuss about like calling about what we are doing here. So we realize that like pandemic hopefully is soon over, maybe over. You know, we may not be at the fight or flight mode at the time where during the pandemic, and this is the time that will be good to reflect on about the trauma, the vulnerability that brought up by the pandemic, especially looking into AAPI community and how that impact of COVID vulnerability to mental health in many of the AAPI children, young adult, and families. Next slides, please. So we realized pandemic had created a lot of trauma to many of us and remind us a lot of stereotype on our identity throughout history. And this is like one of the slides that which is suggesting stereotype is really not new. In 1800, Asian are labeled as dirty, disease, as yellow peril, as a threat to the US, as the picture on the left showing that quite disturbing figure. And to the right, like, and since 1950, yellow peril was replaced by the terminology of model minority. As you see the Time magazine cover, seeing Asian American kids like carrying books, like computers, like eyeglasses, like having this model minority terminology. And in fact, it is harmful to the community. It erases the inter-ethnic differences among Asian. As we know, the Asian diaspora is such a wide heterogeneous population. We have on one end of spectrum, we have highly educated, socioeconomic status are high. On the other spectrum, we also have many of us are struggling from poverty, struggle with refugee statuses, low socioeconomic status who struggle to get mental health services in many of the urban US city. It also, this terminology set up a deceiving contrast from other minority, not to mention it minimizes the impact of racism and discrimination against Asian Americans. Next slide, please. So this is not a new slide from the Stop AAPI Hate website. Since 2021 through December 31st, there were 10,000 hate crimes that reported against Asian American, especially to the vulnerable group, Asian descent women, children, elderly in the coastal city, in subway, street, school, and internet. This is the recent study from CDC 2021 looking at belonging, the sense of belonging. And they look at high school students, they found out 36% of youth experience racism before or during COVID-19 pandemic. And 64% of them are Asian students, along with 55 Blacks or students are Black and or multiple races. So this is an alarming statistic that we see, and this topic has been really overlooked. Next slide, please. And as we all know, as mental health provider, we know the impact of racism. It's almost like introducing the PTSD phenomena, harmful as a psychological and physical health, producing the post-traumatic stress response, including increased fear, anxiety, avoidance, and hypervigilance. phenomena. And as a scientist myself, I also see, like there are epigenetic and genetic impact to the next generation of our children. So this is a really important topic for us to talk about and help our community to understand this. Next slide, please. And even before pandemic happened, Asian Americans are 3 times less likely to seek mental health treatment than any other American. And we see that like many of the Asian American youth, they get to the emergency room with much severe level of mental illness, like and the underutilization of mental health services is really across the board, regardless of different area of United States, age, gender, education, or Asian subgroup. And the underutilization is really not the indicative of lower use, but on the opposite end is really showing the elevated rates of depression and anxiety. And oftentimes people believe that that's the underutilization related to the cross-cultural issue, cross-cultural understanding, and not to mention many of them are struggling with insurance, language barrier, the logistic to seek out for help. And also many of our clinicians also, we educate ourselves a lot, and lack of the understanding of cultural literacy, knowledge, awareness, and sensitivity. That's something we can help each other to learn. Next slide, please. And so we love culture. We love to learn more about cultural concept. So culture makes us strength and resilient, but at the same time, it could create roadblock for AAPI youth and family, particularly talking about trauma within the family. So this bullet point here to summarize some of the cross-cultural concept here. I don't represent the entire AAPI population, but I can summarize this as most of this concept addressed to East or Southeast Asian. And I think as a clinician, it will be really helpful for us to understand some of this concept that may happen in many of our patients who may be second generation Asian American, but the relationship that built with the family, with the parents or grandparents, they are heavily influenced by many of these cultural concepts, including Confucianism, such as humility, hierarchy, harmony versus assertiveness. Like many of the Asian family, we avoid confrontation, we avoid conflict, and that could be perceived as like opposite of being assertive. And the concept of such as individualism versus collectivism, we see that a lot in many AAPI patient population. Concept of being healthy or versus like we getting illness or mental illness, it no longer become an individual matters for many AAPI family. It become a family or even community matters. So it is not uncommon to hear parents to struggle to share about like talking about the kids struggle with suicide, having the kids struggle with gender identity. That becomes so hard to talk about and share with other people because it brings shame and guilt to the entire family. It is so heavily obligated not to talk about, to share. Another concept, conformity of gender roles or cultural norm, especially for Asian women minority in the household. Usually the leader in most cases will be the male figure, and many Asian women will embrace the cultural norm of don't question and just follow, for example. And another example, filial piety, which is like we learn about that. Parents are pretty much the law and have expectation, and the kids in the room will be like having expectation to respect and to follow and obey many of the parents' expectation. And understanding it could be really important to as a clinician to empathize the family. And the next point, stoicism. kind of like eating bitterness, like 吃苦, like tough it up, which is like, would apply to the skit we are going to play tonight, a family who struggle with, being refugee and adversity, the mentality of tough it up and eating bitterness. Sometimes it could be really hard for them to reach out for help, and they could perceive it as a weakness to seek out for help in the case of mental health treatment. Not to mention, it's important to understand the communication style and language, the implicit versus direct, or the love language being expressed in the family, action versus word. I think that communication style does also need to be understood as well. And the last one, acculturation and language barrier, and that certainly it is important to understand that could be the roadblock for family to communicate and connect to each other. Next slide, please. So this is like kind of like the best practice that what I gather for cultural informed care for the AAPI children and family. As I mentioned, it need to be culturally adaptive. It need to be family centered. As I mentioned, the collectivism that like many of the family that we care family so much, and like the collectivism idea that really need to be family center. We want to address the acculturative stress of immigration and acculturative gap that happen in the immigrant family. Intergenerational trauma, which is what we are going to talk about tonight, which is even more difficult topic to navigate. Stigmatizing, and there's like many parents, they cannot even imagine where to start to talk about this issue. Acknowledging racism, microaggression, and cultural identity development, addressing gender role, sexual orientation issue. This is a very important topic as well, especially looking at the intersectional identity, being Asian and LGBTQ identity. That could be an unimaginable conversation in an AAPI family. And introducing the less stigmatizing setting could be really important. I think like tonight we're introducing theater, along with many other artistic format, could be a platform to introduce this less stigmatizing setting. So family will feel safe enough, feel comfortable enough to talk about very difficult topic. And I find that engagement in the community, such as what we are doing tonight, some of us may be parents here on tonight's call, how to engage mental health conversation at the level of the community, such as church, library, community health center. That is where people who engage and reach out to help. If we can create a dialogue of mental health at that community level, that will be a really great way to embrace and break the stigma of the conversation. And also involving primary care provider, which is like usually they reach out for pediatrician for depression, anxiety for their kids. And like this is like something before asking for us to help. So I think the integrated care would be really important as well. Next slide, please. Next slide, please. Yep, thank you. So with all of that thinking in mind, so I want to take this opportunity to introduce a group called Chat Together, as Amelia introduced, Compassionate Home, Action Together. Actually, tonight, AAPI Trauma Healing Program is under this initiative. We are a digital community-based initiative started 3 years ago since pandemic, and we realized the trauma, the vulnerability in AAPI community during the pandemic, and we created Chat Together as a culturally sensitive program, family center, and we tailor for the teens, young adult, and parents. We hope to promote healthy child-parents communication and emotional wellness. So as a way, it's a prevention program, helping the community understanding the language of mental health and help them to facilitate communication for parents and children. And also, of course, hope to break the stigma of mental health in bridging the culture and generation. Next slide, please. So a brief introduction about the 6 components of Chat Together. A big component is what we are doing tonight, interactive theater, as a less stigmatizing platform to talk about mental health. As you will see, we'll showcase and live perform what it does look like. We also have a mental health education for context that related to the skit. We do research. We also have community peer support, collaboration, and mentorship. Next, please. So as tonight, we collaborate with the national professional organization AAPI and local AAPI in Connecticut and Maryland. And as a platform with a community, hopefully we all learning something today and bring something to your community and help the children and family in AAPI patient. Next slide, please. Yep, next slide, please. Okay, so this is the motivation behind the Chat Together skit production. We are inspired by Theater of Oppressed, which is first developed in Brazil in 1970 by Gustavo Vole. So for the right-hand side of this picture is the town hall social meeting when people gather together, talk about controversial topic in the community. And there's a moderator to try to do the improv way and freeze a different point of the conversation. And they engage the audience to come up with an alternative scenario. So using this type of theater way has been implemented into medical education, public health initiative on sexual assault and cancer screening awareness for something very stigmatized, and engage the community to spark discussion about from the skit. And so we inspire by this model, and we implement that into child adolescent psychiatry. We want to turn it into a child parent story and addressing AAPI mental health and the racial identity development. So this is how we did it. We have a Chat Together member who identify themselves as AAPI, and they create the family storytelling around mental health, around the conflict, and they create a script, a dialogue between the teens and parents. After we culturally adapted some of the drama effects in the skit, we actually act out the skit and create digital video and share that on social media. And in some cases, like what we do tonight, we will live perform in a community event, like what we will do today. Next slide, please. So this is an example that in the past 3 years, we have created 26 of this skit video around mental health, around like racial identity development. And we have like a total of 40 volunteers, actors, and skit writers. So this is the example of that. Next slide, please. So tonight, this is the most fun part of tonight. I pass the time to Amelia for a Chat Together theater. Thank you, Amelia.
Thank you, Dr. Yuen. So just as it was mentioned, this is Chat Together Theater Presents AAPI Intergenerational Trauma, The Shark Music. Skit writers include myself and Dr. Yuen. Ashley Ben-Hayun from Nationwide Children's Hospital will be playing the teen daughter, Teresa. And then Emily Wu Trong, a motivational speaker, will be playing the mother. And Dr. Yuen will set the stage now and get us started.
All right, thank you, Amelia. So I will encourage at this time, in case we don't get pinned, if anyone can switch the view as speaker view, so that will be a much better way to view our skit performance. All right, so at this time we have Ashley and Emily, please change the name to Teresa, or you already did, and Mom. And if you can, you can change your virtual background if you like to improve some drama effect. All right, okay. All right, so are we ready? Mom and Teresa. Okay, so let's unmute yourself. All right, okay. All right. Okay, all right. So AAPI Intergenerational Trauma, The Shark Music. Stage setup. In this scene, Teresa reaches out to her mother to share some exciting news about college. Teresa expresses her mental health concern related to a previous experience and tries to ask for emotional support. During this conversation, Teresa really wants to learn about her family history in mental health, as she just started psychotherapy. Mother is a first-generation Asian descent refugee from the Vietnam who migrated to the US. During the process, mother lost her grandfather and a little brother were brought to the psychiatric hospital at the time. However, no one ever talked about what happened. Version 1, problematic scenario, action.
Hi, Mom. Guess what? I'll be going to school in the fall, Harvard.
Harvard, congratulations. How expensive is it?
Thank you. Pretty expensive. I've been feeling anxious and overwhelmed. I haven't been sleeping much.
Are you going to work full time to reduce your loans?
No, I was burnt out and depressed when I worked in high school. I'll keep applying for scholarships and a part-time job later.
That's how it is. Hard work, but you just do it. When I came to America, I went to school full time, worked full time, and was a full-time mom. I did it all on my own. Is your program online?
No, it's in person. I have a therapist now, and I'll be able to see her when school starts to help me work on my depression. Mom, I remember when you were in school, you were really stressed out and spread thin. My therapist the other day asked me about a family history of mental illness. I know someone and something was wrong in our family, but I don't know how to tell her about it. I just want to be proactive about my mental health. You all have talked about how hard the journey to America was, lots of scary things. You saw people killed, but no one openly talks about what happened to Uncle Duck. Didn't he disappear when you first arrived? Where did he go?
I did not need a therapist. Neither do you. Stress is normal. Escaping from Vietnam was much harder, but it made us all stronger, didn't it? No one likes the negative past. Why ruin the harmony? After we escaped from Vietnam, Grandpa died at sea. Duc was 16. He and Grandpa were close. Dad buried Grandpa at sea in the middle of the night. And when Duc woke up, he lost it. When we arrived at the internment camp in Malaysia, Duc ran off and we were separated for some time. When we found him, he was so skinny, had bruises all over his arms, and we couldn't get him to stop crying. In the US, Duc turned into a cursed kid, talking to demons, and was taken to the hospital for 6 months. Mom and Dad didn't know what was going on. We didn't have an interpreter. Your grandparents don't like to talk about this. It's nothing to be proud of, so don't bring it up. Their health is declining. We don't want to make it worse. Better to keep it in the past. Everything is fine.
I can't even imagine what that must have been like for you all. Makes me think there's something in our genes and we keep the taboo going on and on from Grandpa to Uncle to Mom and Dad. I don't want... Mom, I started seeing a therapist because I was feeling depressed, could barely get out of bed most days, and sometimes I started to hurt myself. It took a long time and now I feel better, but maybe it's all connected.
What is wrong with you? You just lazy, staying in bed all day. What do you mean hurt yourself? Stop saying all these selfish things. You don't need a therapist. There is nothing wrong with you. Our family has been through worse and we are all fine. We don't have anything in our genes. No more of this talk. Brings but bad memories. Talking about this makes me depressed. Anyways, when can you call your school to see how, if you can switch to an online program? It's better for you, cheaper that way.
Why do you change the subject when it comes to mental health? I called you to tell you exciting news, but you just want me to change my mind to do what you did.
I speak from experience. I have been there, done that. You don't know what's best for you.
I have agonized over this decision. I don't even know why I decided to tell you. There's more to life than money, you know. Is that all? I'm gonna go. I'll talk to you later.
I am only trying to help you. You don't know what it's like to be a parent until you have kids. Money is a big part of life. You're too spoiled. I don't know how to talk to you.
All right, let's freeze. Everybody take some deep breaths. It sounds like a really hard conversation just now. And I will invite our audience to imagine, no matter you identify yourself as AAPI or not, imagine this conversation could be in your household or could be in your patient that you care for and the patient family. So let's pause and step back and reflect how we did. Now, Teresa, share with us, how do you feel? What do you think what just happened?
I feel a lot of emotions right now. I feel kind of angry because my mom didn't validate any of my emotions or support me when I opened up to her about stuff. And like on top of that all, I just feel really unsupported and invalidated, and that just makes me feel horrible right now.
Oh, I'm sorry you feel that way. So it's like really frustrated, very not feeling understood. Yeah. Okay. Well, Mom, like share with us, what do you think what just happened and how are you feeling?
I think I have PTSD. And when we were in Vietnam, we just had no way, we didn't have good coping skills. And so the only way to cope back in the day was to be able to just suck it up, to just swallow it. And we didn't know how to process that pain. Because the subject of mental health, mental illness was not normalized back in the day. So, so when Teresa shares what her way of coping by seeing a therapist, it's very different from my own experience, because therapy was not normalized back then. So we just, we learn how to just suck it up and save face and, keep going and staying busy.
Thank you for sharing, Mom. It sounds incredibly hard conversation, incredibly hard experience to carry out. I appreciate that. Well, I'm a moderator. I'm trying to be neutral and I'm not pro Mom or pro Teresa, but I just want to bring up some observation to reflect on and also invite our audience when we go to the small group discussion later on. Perhaps we have so many smart brains here. We can brainstorm some of the conversations so we can have a better one when we do this again. All right. So one of the observation I want to bring up is like, the connection, the emotion that you two, especially when when Teresa trying to like initially share like how exciting it is going to college, but somehow we convoluted into some surprising conversation about things in the past. And I imagine that is uncomfortable for Mom, like that, having that going into that vulnerable, painful feeling. It could be really hard. I see that Mom is like kind of staying away and not comfortable about it. Like, and you mentioned about you think you have PTSD. Like, you want to share more to Teresa about how was it like? It looks like you were really busy all this time. You're trying to keep yourself busy.
Yeah. I mean, I think this day and age for the younger generation, they have it better in that it's like immigrants come over here to be able to live the American dream. And so the kids of immigrant parents are able to have the privilege of a different life than what we had and our troubles were much different than what the younger generation has, and so it's just a lot of the times I think the older generation will talk about the sacrifices that we've made, the troubles, the hardships, our kids don't have to deal with having to come over by boat or or have to deal with war or in many things that our younger generation have never had to face, having grown up here in America, the US. And so, I think that it's just sometimes when you grow up in a different generation, you have different value systems. And I think that I probably, as mom, I just kept myself so busy working, going to school and taking care of the kids, taking care of family that, it's easier for me to just stay busy instead of having to deal with my trauma.
I hear you. So it sounds like, almost become a coping way to keep yourself busy, but not being bothered by some of this past experience, the past pain. I want to introduce the concept of shark music, for those of you who are parents on the call, that perhaps the shark music, I'm trying to make a connection here because Teresa is mentioning about going to college, that is tuition, expensive, there's resources are limited, about finance, about money. I'm wondering, I'm trying to make a connection here. I wonder if it is the shark music, the reminder of what happened then to mom, the time of adversity, the time of difficulty to come into the US. And I wonder that that could be a roadblock, be able to connect with Teresa at the time and empathizing what she needs to be cared of. I wonder what it is all about. And for Teresa, I guess I'm curious if you want to share with mom, why will you be interested in knowing about the past? It looks like you are proactive about mental health. You want to learn about your family heritage. What motivates you to do that, to prompt this conversation?
I think that as an Asian American, above all, I just want to learn more about my culture and my family's history because, Mom was talking about, I'm a second generation Asian American and my parents immigrated here, but I grew up really American. I went to school, I'm going to college right now. I grew up in communities with people and kids that were so diverse. And, I celebrated American holidays and watched all these movies and just grew up in the whole culture. And I feel really American, but I'm also Asian American, and I just want to know more about my culture and my family. I can't help but be curious about it, I feel like that's such an important part of me, and I just want to know more about it. And I don't understand why my mom is not sharing things with me. It's just really frustrating.
I hear you. And I think that's also a motivation that, as mom just mentioned, you don't want to talk about the past, but as Teresa, you are both Asian and American. And oftentimes child learn the best from the parents, learning about the Asian heritage. And parents are the best educator to teach Teresa about what's happening in the past. I think that is important to build the identity as the Asian side of her, and she is both Asian American. I think that is important conversation to have. I just want to put it out there that there is a reason to share. There is a reason as a parent to talk about your past. It may not be entirely traumatized. It may not be entirely bad. They are also good and good and bad about our culture. I think that is worth sharing. I guess another observation that I want to bring that up is about reaching out for help, especially talking about mental health. And I hope that in a small group session, we can talk further about that. Teresa, sounds like you're proactive, want to see a therapist, and like which is great, which is what we want to see. And it sounds like mom has some hesitancy about reaching out for mental health. And then something you alluded to, a cultural concept, you mentioned about, that oftentimes you want to be tough it up. There's so many adversity happening. Perhaps for someone having experience like that, it's hard to reach out for help. What is it like to be reaching out for help to you, especially in terms of mental health? Mom?
Oh, it's foreign. It's very foreign because nobody talks about that. And it's not normalized, and what's normalized is saving face. And so you don't bring, show any weakness to anybody around you, because you're supposed to have thick skin and you just keep going, you just keep living, and that's what's normal. And so therapy, that's foreign. Like mental health, nobody talks about feelings, and that's probably why it's harder for me to connect with my daughter, because even though she wants to get to know me, get to know our culture, understand our family histories, we're just supposed to keep it in. And I guess that's probably the roadblock that prevents her from being able to know me better. But I think that one way that could possibly help the younger generation, my daughter, to get to know me is maybe even ask me a question like, Mama, is there anything from your past that, like any good stories that you would like to share from?
That will be the beginning. I would love to see that conversation. That would be a great conversation to start. Yeah, I know, like, I wish our mental health provider would do a better job to explain what could be the treatment option to kind of normalize this conversation. Many of our patients, they never even have any experience of psychotherapy, or what does that look like in a group therapy to talk about problems to a stranger. It's just like unimaginable. Or taking medication, is it addictive? Like, there's so many questions, or like education need to be done. And I wish we could do a better job in that. And I think that's another topic that we can spark more discussion in our small group discussion. Like, for those of you who are clinicians and psychiatrists, how would you talk about mental health treatment option to help your patient and family understanding, what this concept is so foreign for them? How do we help them to understand and be able to, if well informed, to consider each of this treatment to help the child? All right, so if there's one thing, Teresa, if you want mom to change so that this conversation would feel more welcoming to talk about family, history, and story, what would you like her to change?
I think just about the mental health thing, and like what I mentioned before, it would be great if she could just like validate what I'm feeling and just listen to me, or even try to just understand me. I just want to feel supported, and I feel like it shouldn't be that hard. Like, I'm just trying to share, like, I went to therapy, and I also told her, like, I've like hurt myself in the past, and, like, sharing those things can be hard. And I've been through a lot going through those things. And now that I can finally say it, I just want to feel supported and like she's there for me, or at least just listening to me.
So you want to be understood, and you want mom to validate a feeling. Okay. What about mom? What is one thing you want Teresa to change so you can have this conversation, feel more comfortable to welcome this conversation?
Well, I think that when a mother doesn't, when a person in general is not aware of how their own growth has affected their own kids, I think that this is, Emily hat wearing Emily hat, I think that a person is not able to give what they have not given themselves. So if you have not even validated your own feelings from the past, how do you validate anyone else's feelings, even your own children or friends? So I think because putting mom hat back on, I have not received any therapy. So, and I have not validated my own trauma from my own past. How do I even address my daughter's trauma?
Right.
And so I think that's why it makes me incapable to be able to validate her feelings and understand her better. And so I would hope that my daughter would understand that there are many different love languages. And just because I don't love her the way that she needs me to, doesn't mean that I don't love her at all.
Okay. Well, thank you, Mom. So I think that really bring up an important point, how important it is for parents to also have self-compassion, to be take care of themselves. It's like how we can help ourselves to be a better parents, to stay attuned to take care of our child. Okay, so that's the end of the moderation. So I pass the time back to Amelia for our next breakout group session. Thank you.
Thank you all for your feedback and the moderation. My juices are flowing on how to better communicate, so I thank you. And I saw people putting some comments in the chat, so I hope that we can flow right into the breakout group. So now we're going to split up into two groups, each with an actor and a facilitator. Your facilitator will engage you with some improv exercises. This should be fun, engaging, and interactive. This is an opportunity to initiate a conversation with the actor around mental health, trauma, and parenting. Our wonderful teammate Roxana has been working behind the scenes and has kindly assigned attendees to groups. So thank you so much, Roxana. And breakout groups will meet for approximately, I want to say a little bit less than 20 minutes. We might cut it a little bit shorter. And then when there's about 5 minutes remaining, Roxana will send a reminder through Zoom. And then we'll all meet back in this main room.
Are we waiting to break out?
Yes, I'm assigning you now.
Oh, gotcha. Okay.
Yep, I had to manually do it. I'm breaking you out now. I'm moving fast. I'm moving this.
Okay. All right, cool. Thanks, Roxana.
So we could do some breathing exercises while we wait. I know I need to breathe a little bit more. I think I've been holding my breath.
By the way, if anyone is wondering what this green ribbon stands for, it's for mental health awareness. Everybody knows that pink stands for breast cancer awareness, but not many people know that the lime green ribbon stands for mental health awareness. So actually one thing that I do is I will be a fashion statement for mental health awareness. I guess it's not very clear, but it's me wearing a lime green wig. Because the stigma of mental health is just so strong. So I like to have fun with it. Let's see there, not so bright.
I don't see Ashley here. Is Ashley not here?
I'm here. My name is still Teresa. So
Oh, okay. I'm sorry. I totally had a brain freeze. Okay.
sorry.
Thank you, Elaine. Yeah, I have other ones too. Let's see. Here's the other one. Oh, no. Okay, time to go in breakout groups.
Dr. Lay, do you see a link for you to go to the other rooms?
You mean me?
Yes. I'm sorry. How do you?
All right.
Right. Welcome back, everyone. Did we get everyone back? Looks like it. Okay, perfect. Yeah. Well, thank you all for your engaging and thoughtful participation. Before we shift to the panel discussion, our facilitators will share some summaries from each of their groups.
So I can go first. We were in the group with a daughter, and kind of three main teaching points. One is that there is this interesting phenomenon we notice in the skit of normalization of trauma that is commonly found in AAPI families. Several of the participants who were Asian American themselves kind of shared that the things that they observed in the skit, were common things that they saw while growing up, and they didn't realize till maybe later in adulthood that in fact was perhaps not as normalized as they thought it would be, and kind of the help and assistance of therapy can guide through that. And then a second related point is that culture does not equate trauma. So interestingly, Ashley, playing as Teresa, towards the end was saying her desire to get to know her cultural heritage more. And while this conversation was had in the setting of discussion of intergenerational trauma, also keeping in mind that there are parts of culture that are to be celebrated and separated from the trauma itself. And then finally, the third thing is sort of recognizing that trauma and celebration is sort of bidirectional. So the practices such as familiar sacrifice or filial piety, those types of values, and silence about mental health that may have been practiced in the family, oftentimes the silence is passed down through subconscious modeling in a way. So it may take a lot of therapy to sort of unpack that throughout the years, and having providers who are culturally competent or with humility recognize that could be really important.
And our group talked about similar themes. Somehow we also had Ashley in our group, so maybe she has a time turner and can be many places at once. But we started out kind of doing some ideas of role playing of how mom could have responded to some of the things she brought up. There was some really good suggestions on how to validate her, kind of, you know, celebrating her admission to Harvard, and like ways that they can really focus on like the validation of like her achievements, and also like the positive strengths that she has shown. And at the same time, we talked about where mom is coming from, how it can be really hard to think outside of one's own trauma, and you know, easier said than done to do these things, but when you're living it and it's something that you haven't had the luxury or opportunity to kind of process, people can be very reactive based on the things, and especially in the family history that we heard, it maybe made a lot of sense the way mom reacted, given what she's been through and given what she hasn't had the opportunity to do to try to process the things that she went through. And so really focusing on the goal of kind of mutual understanding, even if it isn't perfect communication, starting in a place of understanding where each are coming from. At one point, mom's character kind of said, you know, well, the reason why I reacted this way is because I'm trying to share with you my wisdom, give you advice, and that is what my goal was, you know. And having that shift in frame of, instead of being like, why isn't my mom able to validate me, and these are all of the things she's not doing, it may feel different to focus on kind of first understanding why, maybe not as just like a malicious intent, but rather something that may make a lot of sense if we are able to understand that background. And so we talked about kind of the impact of trauma on communication, as well as at the end, the differences in terms of affection and showing of love in different cultures. Like I think Emily had brought up before, different love languages of maybe in Asian cultures, a lot of the time it's not verbal, direct expressions of affection or love, but in the culture, the love is shown in like all kinds of different ways, often in acts of service, in gift giving, in trying to provide stability. And so even if, I think it was mentioned before, even if you're not saying I love you, you're saying it in all these different ways, and being aware of that cultural component can also be really helpful.
Absolutely. Thank you. Thank you both. You know, common threads here, you know, increase understanding. How do we get there, right? How do we meet in the middle? How do we understand both sides, and also accept each other's past, and accept that, hey, this is how you are, this is how you've been raised, but how do we come together at the end? So to capture what we've learned from the breakout groups, our panelists will relate the skit content to their clinical or lived experiences. And for the sake of time, I think I might just like maybe read one line of the shortened bio, but I'll paste it into the chat. So I'll try to go quickly here. So we have Emily Wu Trong, Dr. Elaine Shen, Dr. Crystal Han, Dr. Lei So. I think we have a PowerPoint and moderated by Dr. Yuen, and some brief introductions. Actually, I think I'll just, how do we feel about just skipping the introduction, going to the panel, and I'll put all of the bio in the
That
chat.
sounds
Okay.
good. We can do that.
Sounds good. I'll do that. Thank you.
Well, thank you all. I think like both our breakout group, like we have such a fruitful discussion. Like it is really incredible. We get to start a lot of interesting conversation, and then we learn from each other. So thank you so much for all the participation, and our facilitator, and summarize what we just learned. I guess like for many of our panelists, like who have so much experience working with AAPI youth, young adult, and parents, any of your experience or like can relate to the skit or any of that you can share to some of the cultural concept that we discussed just now? Feel free to unmute yourself and share.
Yeah, I think in my experience, there's just like, especially the intergenerational cultural gap in terms of influencing the expected roles parents and children have is a big source of challenges. For example, in one family I worked with, the mother really saw her role as a good mother is to be strict and provide good guidance and provide good advice and provide, safety and her physical needs met. And that was mom's definition of what a good mother should do. And if she was too lenient and let her daughter do whatever she wants, or was too emotionally giving, it would not prepare her daughter for the harsh real world, because this mother also had a lot of trauma. And so I think that really understanding kind of like the role expectations and trying to find some middle balance of compromise for both is really easier said than done, but kind of what was most helpful in that setting, and really focusing on kind of like what are both of their goals. Their goals is both for them both to have a good relationship, be happy, and be healthy. What are some compromises both are able to make in aims of that goal? And sometimes that involves compromise on both parts and understanding. So that's kind of what my mind comes to.
Yeah. Thank you,
I
Dr.
mean,
Han.
yeah,
Go
I
ahead.
mean, okay. Well, in response to what Crystal was saying, I mean, like growing up, I was thinking like, okay, like one of my first ever talks was about that subject, like, because, parents will be like, why can't my kids be this way? And then the kids are like, well, why can't my parents be this way? It's just like, and so it's a struggle, because it's like, well, the immigrant parents grow up in a different background. And so what they imagine life to be like is going to be much different from the country that they came from. And then us as kids, we're like, well, weren't asked to be born. So, but we're born, so we're stuck. And we get guilt trips for not appreciating our parents when we speak out, because Asian parents are like, like when I was your age, like we were told to respect our parents, like, and respect in their generation means you just obey them. Right? But then when we're here in the US as a kid, we're like, well, respect can also mean that I can have my own opinion and you can have yours, and we can agree to disagree, but that's where kids born of immigrant parents can be stuck. It's like, which value system, which culture do I live in? And like, and it's challenging. And because my parents, who were, grew up traditionally, it was not customary for them to be able to share their true thoughts, how they really felt while they were growing up. They just do as they're told. But here, where I'm born in the States, I'm like, yeah, but I want to be heard. But if I don't feel heard, then I start to internalize that and feel like my voice doesn't matter. So, but that's what happened to me.
Yeah, thank you. I know we are running over time, and like I'm hoping to like anything wisdom from you, Dr. So, want to share with us that you related to the skit and the experience.
And happy
Yeah,
birthday.
Yeah,
I think
happy
it's
birthday.
probably just recognize and intergeneration just have a difference. So I think, if, we want to change, I think I have to recognize it. So that's, I think, try to understand where they're from. And then I think the parents, from the culture understand is a hierarchy, and they know this way, it worked for them. That's a part of, they want to pass on. And the next generation will do the same to try to maintain in the system. So, I think, older generation want to reserve the system, the tradition, and the younger generation want to challenge the system. So they gonna have the difference, and let them to both recognize it and to figure out the way, and the family is okay, even have the difference, and the kids are doing well. So they won't feel they lose control and they don't know how to parent anymore.
Thank you, Dr. So. I know we are running behind, and this is like the slide of some surveys, simple 5 survey questions to help us to provide some feedback to our event tonight. There's a link in the chat box, and also the QR code if you can scan using your phone. Keep a few minutes here. We really appreciate your response. It will be really helpful for us to plan for future events using interactive theater and skits. Thank you.
I wonder if the audience had any more questions for us or like wanted to engage us in any dialogue, because we actually still have a lot of people here right now. 23 people is a lot.
Yeah, feel free to ask us any question or discussion.
You did have a question in the chat about if it would be better to have this discussion in person because it's a triggering topic, and if the daughter was in true crisis, how would it be okay to do the talk virtually? I'll repost it in the chat again.
Hi, can I ask a quick question? Just a quick comment. So I'm a parent. I just want to raise the issue of like multi-generation families, like in our community, which is a huge thing. But like I came to the US after college, but many of my friends, like people in my community and our organization, we had the same path, right? We came here as graduate students, and when we raised kids, our parents help us because the vast majority of us, the women work, it's double career families. So it's like 3 generations living together. So I think today, like the program is really awesome. Like all the points are really like right on spot. And it's, but I'm just saying, like in 3-generation families, there's another layer of complexity because we all live that. So it took me kind of years to, to sort of navigate this. And I just stepped down as president of this nonprofit organization based in New Jersey. It's called Parent and Child Education Club. It's mostly like Mandarin dominant parents like myself, kind of try to learn American parenting. Like, we read American parenting books and try to support our kids. And our programming is predominantly in Mandarin because many of our members feel like, it's more authentic for them to do things in Mandarin. So I'm a little more comfortable with English than most of our members. So I always try to push the organization toward like a bilingual direction, but it's challenging. But thank you so much for the program. Will a recording be available? Okay, I'll definitely share the recording widely. I think it's wonderful.
Thank you so much for your comment. And I can imagine like the cross 3 generation, the language barrier even have another more layers. So like if we could have like bilingual clinician who can run the same webinar in Mandarin, that will be amazing.
I mean, I always wanted to change the dialogue. Like, I mean, growing up, like, I think because growing in the Asian culture, like, I think we follow Confucius ideas of like, oh, respect your elders, and your elders are the ones who know more than you because they've lived longer than you. But it's just like, yeah, but if you've lived longer than me, then why can't you show me how to do things? Like, I'm just like, I can't deal with perfectionism. I can't deal with just getting things right the first time around. Like, I don't understand that it's okay to make mistakes. And, and like, that's how I grew up. I even grew up that like, oh, Asians are so judgmental. Like, they're like, that's how I felt. And so it made it very hard to open up in the API community because I didn't know who was safe to talk to. And because you don't know whether they're gonna judge you for like, oh, but you don't have a PhD, or you didn't go to an Ivy League, or you didn't have straight A's, or you don't have a full-time job that like has a high salary. It's just like, yeah, but when you die, like, what are you gonna be known for? All those things? Or what? How were you a good person? Like, what is the legacy that you want to leave behind? And I was always wanted to talk about these kinds of things when I was growing up, but I don't know. I just felt like I was surrounded by people who thought about like, oh, like status. So I don't know. So that was hard for me. When people don't know how to have those hard conversations about the meaning of life and taboo topics that are just very hard to talk about, emotions, feelings, like the conversation will never start. But I think this is one place that is a cycle breaker, because we're having discussions on how do we have these hard conversations? How do we change them so that the next generation can have it easier to, you have to start somewhere. Have those family conversations. As uncomfortable as it gets, you have to start somewhere. And then it will get easier once you just start.
Yeah, I can agree more. Thank you, Emily. Thank you, everyone, for all the feedback and questions. So like, I know we are running over time. Lastly, but not least, I want to thank you all of you who joined us tonight. It is such a wonderful conversation. I hope after tonight, it is one of the many conversations with coming. We need to create a welcoming community, talk about this important topic and cross-generation. So we break the stigma of this intergenerational trauma and mental health. And so last but not least, want to thank you for our grant support from ACAP Advocacy and Collaboration Grant, for all of the panel, for everyone who worked behind the scene or Roxanne and Jill from two ACAP local organization. Thank you all the support and for tonight. And also this is a QR code for chat together. We have a lot of related similar skit video that share on social media. And so we want to create this conversation continue again. And thank you so much tonight for joining us. And for those of you who want to stay behind, we can stay a little bit to talk more. And have a good night. Thank you for joining us. And again, if you can, please feel free to fill out the survey to help us create more programming in the future. Thank you. Thank you.
Thank you guys so much for the presentation and the seminar session. You really helped me to understand my children who are raised here. Thank you so much.
Yay. Thank you,
Okay.
Eunice.
Yeah, have a good night.
Yeah, you
Have a
too.
good
Take
night.
care.
Bye, guys. Thank you.
Mhm. Oh, it's still recording? Oh, Roxana, you're still recording.
Yes, I'm stopping it now.